Vitamin D deficiency. Vitamin D is important for our body, and when we don't get enough of it from sunlight or our diet, we can have what's called a vitamin D deficiency. People often call vitamin D the sunshine vitamin, because our skin can make it when it's exposed to sunlight. Besides supporting our bones, vitamin D has gained attention for its role in our immune system, especially concerning illnesses like COVID-19. It's not uncommon for people around the world to have a lack of vitamin D. Why is vitamin D so important? Vitamin D is a type of vitamin that dissolves in fat and is really important for your body. It helps keep your bones strong and supports your immune system. There's also evidence that it may lower the risk of cancer and protect against certain health problems like bone loss, depression, type 2 diabetes, heart disease, multiple sclerosis. Surprisingly, about 1 billion people worldwide don't have enough vitamin D in their blood. So, making sure you have enough vitamin D is crucial for your overall health. Symptoms and signs of vitamin D deficiency. Spotting a lack of vitamin D can be tricky since symptoms might not show up for a while, possibly even years. In some cases, you might not feel any symptoms at all. But, it's good to be aware of what to watch out for just in case. Frequent illness or infections. Vitamin D is super important for keeping your immune system strong, helping you fight off viruses and bacteria that make you sick. It directly works with cells that tackle infections. If you find yourself getting sick a lot, especially with things like colds or the flu, having low levels of vitamin D might be part of the problem. Tiredness and fatigue. Feeling tired can come from various reasons, and one of them might be not having enough vitamin D. Unlike things like stress, feeling down, or trouble sleeping that you can see, not having the right amount of vitamin D often gets overlooked as a reason for feeling tired. Bone and back pain. Bone and lower back pain could be signs of not having enough vitamin D in your body. Vitamin D is important for keeping your bones healthy by helping your body absorb calcium. However, it's important to note that more research is needed to fully understand the relationship between vitamin D levels and different types of pain. Depression. Not having enough vitamin D has been connected to feeling down, especially in older adults, although some studies don't agree on this. Taking vitamin D supplements seems to have different effects, but some reviews suggest that they can help ease symptoms of depression. However, we still need more research to fully understand how vitamin D and depression are related. Delayed healing of wounds. If your wounds take a long time to heal after surgery or injury, it could mean that your vitamin D levels are too low. Some research in test tubes suggests that vitamin D helps produce important compounds needed for the skin to heal in the wound healing process. Vitamin D plays a role in controlling inflammation and fighting infections, which are crucial for proper healing. An older study with 221 participants, including 112 with diabetes-related foot infections, showed that severe vitamin D deficiency was linked to higher levels of inflammatory markers that can slow down healing. However, more research is needed to fully understand the connection between vitamin D and the healing process. Bone loss. Vitamin D is vital for absorbing calcium and maintaining bone health. Taking vitamin D and calcium together helps your body absorb them better. Low bone density, indicating calcium loss, puts older adults, especially women, at a higher risk of fractures. A study with over 1,100 middle-aged menopausal or postmenopausal women showed a strong link between low vitamin D levels and low bone density. However, research on vitamin D supplements for older adults has mixed results. Some studies suggest benefits like reduced muscle pain, but others haven't shown it prevents bone loss-related fractures. High-dose supplements may not improve bone density in women with vitamin D deficiency. Hair loss. Various factors, including stress and health conditions, can impact hair health. While stress commonly causes hair loss, severe hair loss may indicate a disease or lack of essential nutrients. In women, low levels of vitamin D are linked to hair loss, especially in conditions like alopecia areata, an autoimmune disease causing significant hair loss. Studies suggest that higher vitamin D levels may be associated with less hair loss, as seen in non-scarring hair loss. In one study, people with alopecia areata showed more severe hair loss with lower vitamin D levels. Another study found that applying a synthetic form of vitamin D topically significantly increased hair regrowth in individuals with this condition. Although more research is needed. Muscle pain. Muscle pain causes can be tricky to figure out, but there's evidence suggesting that a lack of vitamin D might be a factor. In an older study, it was discovered that 71% of people experiencing chronic pain were deficient in vitamin D. Your body has receptors for vitamin D in nerve cells that sense pain, and this vitamin may be involved in your body's pain signaling pathways, contributing to chronic pain. Weight gain. Being overweight is a risk for not having enough vitamin D. In one study with adults, having low vitamin D was connected to belly fat and weight gain, especially in men. Even though vitamin D deficiency is seen in obesity, more research is needed to know if taking vitamin D supplements can stop weight gain. Anxiety. Not having enough vitamin D is connected to anxiety disorders. In one review, people with anxiety and depression had lower levels of a vitamin D form called calcidiol. Another study with pregnant women showed that having enough vitamin D might lessen anxiety, improve sleep, and possibly prevent postpartum depression. However, more research is needed to be sure about these connections. Causes of vitamin D deficiency. Vitamin D deficiency is when your blood levels are below 20 nanograms per milliliter, and insufficient levels range from 21 to 29 nanograms per milliliter. Various factors contribute to the risk of deficiency. Dark skin, older age, overweight or obesity, limited fish or dairy consumption, living far from the equator or in areas with little sunlight, spending most of the time indoors or working night shifts, chronic kidney disease, liver disease or hyperparathyroidism. Health conditions affecting nutrient absorption, for example, Crohn's disease or celiac disease. Gastric bypass surgery. Certain medications like statins and steroids. Living near the equator with regular sun exposure reduces the risk, but sunscreen use can increase the risk. It's essential to consult a healthcare professional if you are at risk of vitamin D deficiency. Treating vitamin D deficiency. To treat vitamin D deficiency, you usually take supplements. If your doctor discovers a deficiency, they might suggest supplements. You can buy these without a prescription, but it's best to ask your doctor about the right amount. Magnesium. Taking this mineral can help activate vitamin D. Prescription options for a severe deficiency. Your doctor might prescribe stronger vitamin D doses. Food sources. To increase your vitamin D levels, try eating more of these foods. Fatty fish, egg yolks, fortified cereals, fortified milk and juices, yogurt, beef liver. Getting sunlight is also good for vitamin D. Key takeaways. Vitamin D deficiency is quite common, and its symptoms are often subtle and not very specific. It can be challenging to figure out if you lack vitamin D or have another health issue. If you suspect a deficiency, consult a healthcare professional for a blood test. Treatment usually involves taking supplements, but it's essential to get the right dosage with a doctor's guidance. Spending more time in the sun and eating foods rich in vitamin D, like fatty fish and fortified dairy, can also be helpful. Dealing with a vitamin D deficiency is important and can bring lasting health benefits.